Is mass screening for MRSA appropriate?
The question of whether mass screening for MRSA is appropriate really can't be answered with the available data. There have been studies done which have not generated a consensus answer to the question. The studies are difficult to do and difficult to interpret. So we don't yet know the role of mass screening. What I do feel comfortable saying is that it is not appropriate to mandate an activity for which we do not have adequate data to tell us that it works.
Concerning mass screening for MRSA, I think the operative term is mass. If you're talking outside the hospital, I think it's clearly inappropriate. Whether it has a role in the hospital or not remains to be determined. The available data don't indicate that screening alone is beneficial. And I think it has to be driven by outcome. So there might be settings where screening could be useful. For example, if you had a high MRSA rate, or if you were focusing on a surgical population, for example, screening might be useful. But in terms of screening everyone on entry into the hospital, when there is so much community MRSA, I think is frankly a waste of energy, time, and money.
Well, from what Dr. Chambers presented, I think today, it's fair to say that there's not enough data to suggest mass screening. Could you possibly envision, again, being proactive situations where one might be thinking about it? I would potentially target surgical patients, orthopedic patients with implants, or potentially cardiothoracic patients for which an MRSA infection poses significant morbidity and mortality. I would begin to look at those patients first, but I think in terms of mass screening, I don't think we have enough evidence to push that forward, given in an era of limited resources.
Well, I think that the data to date do not suggest that mass screening is associated with appreciable benefits. There are single-center experiences that have shown various outcomes, but the preponderance of data, as shown by Dr. Chambers, really does not suggest that mass screening is helpful and associated with better outcomes in terms of morbidity or mortality.